All India Radio presents Morning News. Good morning, I'm Sunil Verma and with me is Subhadra Ramachandran. The headlines. Prime Minister Narendra Modi to interact with the Chief Ministers of 21 states and union territories this afternoon. Centre asks states to engage with private sector for increasing healthcare infrastructure and providing critical care at reasonable rates. Home Minister Amit Shah directs installation of CCTVs in all COVID hospitals of Delhi. Tamil Nadu announces complete lockdown in Chennai and adjoining areas from Friday till month end. 2 Indian officials of the High Commission arrested in Pakistan, released. India joins global partnership on artificial intelligence to actively participate in development of artificial intelligence. Prime Minister Narendra Modi will interact with the Chief Ministers of all states and union territories today and tomorrow at 3 p.m. He will interact with them through video conferencing. The Prime Minister will interact with 21 states and union territories today. These include Punjab, Assam, Kerala, Uttarakhand, Jharkhand, Chhattisgarh, Tripura, Himachal, Chandigarh, Goa, Manipur, Nagaland, Ladakh, Puducherry, Arunachal, Meghalaya, Mizoram, Andaman and Nicobar Islands, Dadra and Nagar Haveli, and Daman and Diu, Sikkim and Lakshadweep. Tomorrow the Prime Minister will interact with the remaining 15 states and union territories. Our correspondent reports that the Prime Minister held a detailed meeting with senior ministers and officials, including Home Minister and Health Minister, on the 13th of this month to review India's response to the pandemic. A report.
The meeting assumes significance in the wake of the rising number of coronavirus cases in the country. This will be the 6th meeting of the Prime Minister with the Chief Ministers since the announcement of nationwide lockdown in March. Currently, the country is under the 5th phase of the lockdown, which entails much more relaxations than the previous ones. Under Lockdown 1.0, the centre and the state governments have eased several restrictions for the convenience of public and businesses to ensure that economic activities gather momentum. With Dipendra Kumar, Suparna Sekya, AIR News, Delhi.
The centre has asked states to engage with the private sector for augmenting healthcare infrastructure and provisioning of critical care at reasonable rates. Health Ministry said some states have already taken initiatives in this regard. They have reached an agreement with the private sector on reasonable rates and arrangements to provide critical care for inpatient admissions. The ministry said there have been several reports indicating an emerging shortage of healthcare infrastructure, including hospitals with ICU beds, ventilators, oxygen-supported beds for management of COVID-19 patients. There have also been reports of overcharging by healthcare providers for COVID-19 treatment. It said Pradhan Mantri Jan Arogya Yojana and CGHS package rates are already available with the states. The ministry said it has been suggested that the rates once fixed must be widely publicized so that both the patients and service providers are fully aware and capacities are used optimally. States have also been asked to proactively engage with the private sector health providers and consider pooling in public and private healthcare facilities. This will help in providing prompt, good quality and reasonable healthcare to COVID-19 patients.
Home Minister Amit Shah paid a surprise visit to Lok Nayak Jayaprakash Narayan Hospital in New Delhi yesterday to review arrangements related to COVID-19. During the review meeting, Mr. Shah directed the Delhi Chief Secretary Vijay Dev to install CCTV cameras in corona wards of every corona hospital so that there is proper monitoring and problems of patients can also be resolved. Home Minister also directed the Delhi Chief Secretary that backups for canteens supplying food should also be established so that in case there is an infection in one canteen, patients can continue to get food without disruption. He also directed that psychosocial counseling of doctors and nurses engaged in their service to humanity through the treatment of corona patients should also be done. Delhi government has instructed its Public Works Department to install CCTV cameras in COVID-19 wards of all its coronavirus designated hospitals. The order came soon after Home Minister Amit Shah directed Delhi Chief Secretary Vijay Kumar Dev to install CCTV camera in COVID-19 wards of every designated hospital in the national capital for proper monitoring of services and ensuring patients' issues are resolved. It said PWD will install CCTV cameras in all COVID wards within 24 hours and submit a compliance report.
A total of 1,647 new confirmed cases of coronavirus were reported in Delhi during the last 24 hours, taking the total number of cases to 42,829. The Delhi government has confirmed that 16,427 people affected with coronavirus have been cured so far. 73 new deaths were reported in the national capital, taking the toll to 1,400. Uttar Pradesh Chief Minister Yogi Adityanath has asked officials to make extra arrangements in the districts of NCR region and increase capacity of the COVID hospitals. He has also appealed to the people of the state to maintain social distancing and follow the guidelines of government, as unlock also means discipline. More from our correspondent.
Taking a strong view of the rising cases in National Capital Region, Chief Minister Yogi Adityanath asked officials to increase number of beds and health workers in districts close to NCR. Additional Chief Secretary Home Avnish Awasthi said that presiding over a high-level meeting yesterday, Chief Minister has made a special mention of Gautam Buddha Nagar, Ghaziabad, Meerut, Bagpat, Hapur and Bulandshahr districts, and said that the treatment facilities in these districts should be enhanced. In the last couple of days, number of corona patients have increased in these districts. Chief Minister also emphasized that there should be availability of oxygen in hospitals and provision of its backup. Talking about the need of self-discipline, Chief Minister appealed to the people of the state to follow the social distancing norms and must not come out during night restrictions, which are in place from 9 p.m. to 5 a.m. He said that since the time is very crucial for everyone, the discipline is very necessary right now. Sushil Chandra Tiwari, AIR News, Lucknow.
In Bihar, testing of samples for coronavirus infection has begun in all districts of the state. Secretary of Health Department Lokesh Kumar Singh said now testing of samples is being done at 41 places spread in 38 districts of the state. Out of these, true NAT tests are being done at 34 places. The death toll in the state is 38 and the total number of positive cases is 6,662 in the state. In all, 4,226 patients have recovered. The recovery rate of patients has gone up to over 63%. In Jharkhand, there has been no percentage prevalence of community transmission found in the Sero survey conducted by Indian Council of Medical Research ICMR in 3 districts of the state. Based on the reports received by ICMR, there is no community transmission of COVID-19 in Jharkhand. Principal Health Secretary Dr. Nitin Kulkarni told AIR News that 3 districts of Jharkhand, Pakur, Latehar and Simdega, out of 200 districts from across the country were selected for Sero survey to detect the spread of COVID-19 infection in specific regions. He said that the results show that there is a zero transmission in Latehar, 1.25% in Pakur and 1% in Simdega, which is insignificant number to establish the prevalence of viral spread.
In Madhya Pradesh, the state government is planning to provide oximeters at mohalla and colony level. The coronavirus case count in the state reached 10,935, with 133 new patients being detected in the last 24 hours. The death toll in the state stands at 465. Officials said that oximeters will not only help to control corona infection, but will also make survey work easier. More from our correspondent.
Chief Minister Shivraj Singh Chauhan said that we also want to partner the general public with the administration for the corona control, because the coronavirus problem will only be eradicated completely with the help of the public. Meanwhile, to make the general public aware of the importance of social distancing, the government is also going to appoint vigilant representatives. These will be selected from among the public. The responsibility of vigilant representatives will be to make the general public aware of the corona infection. At the same time, more than 210,000 people have been treated free of charge through fever clinic in Madhya Pradesh. The state government has established 909 fever clinics to provide easy health facilities and essential medicines to the people in the state. Cold, cough and fever are being treated free of charge by doctors in these clinics. Samples of suspected patients are also being taken when needed. Sanjeev Sharma, AIR News, Bhopal.
A statewide 10-day-long special campaign will be launched in Rajasthan to create awareness about COVID-19. The campaign will be launched from 21st of June. Under the campaign, state health department teams will conduct door-to-door active surveillance and create awareness about the precautions to be taken for prevention and control of COVID-19. We have more from our correspondent.
6 lakh samples of COVID-19 have been tested so far in the state. Maximum 1,10,000 samples have been tested in Jodhpur district. Health Minister Dr. Raghu Sharma told that investigation facility has been developed in 17 districts of the state. Soon corona tests will be conducted in the remaining districts. The state government has also decided to conduct 5,000 tests daily for neighboring states. The recovery rate of COVID patients has increased to 75% in the state. The number of COVID positive persons has gone up to 12,981 in the state, out of which 9,785 people have been recovered, while 301 persons have been died due to corona infection in the state. Jitendra Dwivedi, AIR News, Jaipur.
In Gujarat, a total of 514 new coronavirus cases were reported in the last 24 hours, taking the count to 24,104. Similarly, the death toll in the state rose to 1,506. Deputy Chief Minister Nitin Patel yesterday announced an increase in petrol and diesel prices each by 2 rupees. Our correspondent reports that the new prices were made effective from yesterday midnight. A report.
Briefing the media, Deputy Chief Minister Nitin Patel said the Gujarat government has incurred an estimated loss of rupees 24,000 to 26,000 crore due to COVID-19 lockdown. On the other hand, the government has made additional expenses to meet the pandemic. He said the decision of hike in the petrol and diesel prices was taken by a core committee headed by Chief Minister as per the recommendation of Hasmukh Adia committee. Mr. Patel informed that even after the hike, the petrol and diesel prices in the state remains lowest in the country. Mr. Patel said if the sale of petrol and diesel is maintained, then the state income is estimated to increase by rupees 1,500 to 1,800 crore. The Gujarat government is also likely to incur 10,000 crore rupees loss on GST collection this year. Aparna Khund, AR News, Ahmedabad.
The Defence Institute of Advanced Technology DU has developed biodegradable face mask based on nanofibers of Ayurvedic products, which acts as a virus neutralizer and resists the bacteria. The mask has been named Pavitrapati. The mask made from herbal extracts like neem oil, turmeric, Krishna tulsi, ajwain, black pepper, gum arabic, clove, sandalwood and saffron. Keeping in view of the Ministry of Ayush guidelines, Pavitrapati uses additives from immunity-boosting agents for self-care. This product shall be used routinely as a mask to protect from any type of communicable diseases through airborne medium. A Mumbai correspondent has filed this report.
The biodegradable face mask is antibacterial, antifungal, antiviral, porous, superhydrophobic outer layer and hydrophilic that inner layer. This technique has proved that non-woven membrane between the woven fabrics supports to block droplets, splashes, sprays, bacteria and viruses. The product was tested for air permeability and breathability as per ASTM D737 standards. The product will be used as personal protection equipment PPE as garments, gloves, gown, face protection, head cover, etc. The DIAT has decided to offer this technology free of cost to potential manufacturers and many firms have shown interest for the same. Sonali Ghadar Patil, AIR News, Mumbai.
A team of researchers in the Indian Institute of Science, IISc in Bengaluru, have developed Workplace Readiness Indicator for organizations to insulate their workplaces from corona pandemic. It is an online assessment tool developed in collaboration with the Karnataka State Disaster Management Authority for ensuring safe workplaces. Cisco had given its CSR fund to set up a new Center for Networked Intelligence to carry out this research. An organization can enter relevant information about their workplace, and the tool developed by IISc will calculate readiness using 10 specific indices like infrastructure, precautions, outreach, employees' interaction level, transport, among others.
In Telangana, the state government has capped the costs of diagnostic tests and COVID-19 treatment in private laboratories and hospitals, while it is getting ready to take up 50,000 tests, especially in COVID-intense areas like Hyderabad. State Medical and Health Minister E. Rajender announced that private diagnostic labs authorized by the ICMR will not charge more than 2,200 rupees per test. Hospitals, including corporate ones, cannot exceed 4,000 rupees per day in normal wards, 7,500 rupees in intensive care units, and 9,000 rupees with ventilator support. However, a special task force will monitor the private hospitals, and these hospitals have to give details for all patients tested positive and getting treatment. The state reported 219 new coronavirus positive cases yesterday. With this, total reported COVID-19 cases in the state have gone up to 5,193. The death toll due to COVID-19 and other comorbidities to 187. You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. Prime Minister Narendra Modi to interact with the Chief Ministers of 21 states and Union Territories this afternoon. Centre asks states to engage with private sector for increasing healthcare infrastructure and providing critical care at reasonable rates. Home Minister Amit Shah directs installation of CCTVs in all COVID hospitals of Delhi. Tamil Nadu announces complete lockdown in Chennai and adjoining areas from Friday till month end. 2 Indian officials of the High Commission arrested in Pakistan released. And India joins global partnership on artificial intelligence to actively participate in development of artificial intelligence. For quick news updates around the clock, follow us on our Twitter handle @AIR News Alerts.
अपने साथ अपनों का ध्यान रखो, बड़े बुजुर्गों का तुम ध्यान रखो, तो बात करो, कुछ मदद करो, कोरोना के चलते याद रखो, घर से निकलो तो मास्क पहनना, मास्क के पीछे मुस्कुराना, सुरक्षित दादा दादी नाना नानी अभियान, अपने साथ अपनों का ध्यान.
In Tamil Nadu, the state government has announced a complete lockdown in Chennai and its adjoining areas from coming Friday till the end of this month. In a statement, Chief Minister Edapadi Palaniswamy said shops will be allowed to operate from 8 in the morning till 2 in the afternoon during the full lockdown. He also announced a dole of 1,000 rupees each for all families with ration cards living in the region where the full lockdown is to be implemented. The Unorganized Labour Welfare Board members will also be given relief of 1,000 rupees each to help them during the time of the full lockdown. The total COVID-19 infection in Tamil Nadu has risen to 46,504, with 1,843 new cases confirmed yesterday. More from our correspondent.
The Tamil Nadu government has rejected the principal opposition DMK's charge that it is directionless in tackling the COVID-19 pandemic. Responding to the opposition leader M.K. Stalin's media release that the government is hiding the actual information on the number of victims due to the disease, the State Health Minister Dr. Vijay Bhaskar has said the data are put in the public domain every day transparently. Early detection of the infected cases and prompt medical intervention is the government's strategy. He claimed that Chennai tops in carrying out tests, saying the number of beds and medical staff strength to overcome the disease is being scaled up in commensurate with the increasing caseload. Meanwhile, the authorities are bracing themselves up to implement the full lockdown from the 19th to the 30th of this month in the worst affected Chennai and its adjoining areas rigorously. Jai Singh, AIR News, Chennai.
Even though the rate of infection is well under control in Puducherry, the Union Territory Administration is leaving no stone unturned to contain the spread. The 5 major roads that lead to Puducherry remain sealed and a strict vigil has been mounted to prevent people from entering the Union Territory. Despite all preventive measures, the rate of infection is on the rise. However, the administration is more skeptical about the prevailing situation in the local vegetable market.
Owing to the public demand, very recently the vegetable market in Puducherry was shifted from the makeshift arrangements to its traditional Guber market in Nehru Street. The government is now once again shifting the market, but this time to AFT grounds in Puducherry, where they can at least ensure social distancing. The district collector has said that the social distancing cannot be maintained with the available facilities and arrangements in the Guber market, and hence shifting it to an open ground. Taking cue from the neighbouring Chennai city, where the epidemic spread from its vegetable market, Puducherry government is determined to ensure that all preventive measures is adopted in the makeshift market, which will be functional from Wednesday. Officials have been given responsibilities to control the flow of vehicles and to ensure social distancing and also to coordinate between the traders. Chidambaranathan, AR News, Puducherry.
The head of the World Health Organization, Tedros Adhanom Ghebreyesus, has said that more than 1 lakh confirmed cases of coronavirus have been reported worldwide each day over the past 2 weeks, while it took more than 2 months for the first 1 lakh cases to be reported. He said that almost 75% of recent cases have been reported from 10 countries, mostly in the Americas and South Asia. WHO added that there have been an increase in the number of cases in Africa, Eastern Europe, Central Asia and Middle East as well. The global public health body said that even the countries that have demonstrated the ability to suppress COVID-19 transmission must stay alert to the possibility of resurgence. Briefing media yesterday, WHO Director noted that China reported a new cluster of COVID-19 cases in Beijing after more than 50 days without a case in the city. More than 100 cases have now been confirmed in Beijing, and the origin and extent of the outbreak are being investigated. In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Talking to AIR News, Director AIMS, Dr. Randeep Guleria advised people, and especially those in the hotspot zones, to sincerely follow lockdown measures to break the chain of transmission of COVID-19 infection.
Because Bengaluru generates almost 4,000 tons of waste, of which part of it is dry, most of it is wet waste. So presently there is a slight mismatch in terms of the waste generated and the processing capacity. But we are in the process of enhancing the capacity. As on date, almost around 800 tons of wet waste is being processed in these centers. So these centers are being underutilized simply because of the fact that even the segregation levels in the city are a bit low. So with the new SWM bylaws that we have notified, with steep penalties for non-segregation and ensuring better waste management, we hope to improve the segregation, which will help use optimally the processing facilities that we have.
In view of the pandemic this year, the International Yoga Day on 21st of June will be celebrated on digital media platforms, and there would be no mass gatherings. This year's theme is Yoga at Home and Yoga with Family. Ministry of Ayush has also appealed to the people to join the world for the yoga performance on the occasion of the 6th International Day of Yoga on 21st June at 7 a.m. from their homes. It said people should prepare for the yoga performance according to Common Yoga Protocol CYP. Ministry of Ayush, in association with Prasar Bharati, is also organizing a daily telecast of the Common Yoga Protocol on DD Bharati. The protocol sessions are being telecast daily in the morning from 8 a.m. to 8:30 a.m. The half-an-hour session will cover all the major aspects of the Common Yoga Protocol. India joined the League of Leading Economies, including the USA, the UK, EU, Australia, Canada, France, and others, to launch the Global Partnership on Artificial Intelligence GPAI yesterday. In collaboration with partners and international organizations, GPAI will bring together leading experts from industry, civil society, governments and academia to collaborate to promote responsible evolution of artificial intelligence. It will also evolve methodologies to show how artificial intelligence can be leveraged to better respond to the present global crisis around COVID-19. By joining GPAI as a founding member, India will actively participate in the global development of artificial intelligence, leveraging upon its experience around use of digital technologies for inclusive growth.
Two officials of Indian High Commission in Pakistan who went missing and were reportedly arrested earlier yesterday have been released and are back at the Indian mission. India had earlier in the day summoned Pakistan Shah Dafei Syed Haider Shah and issued a démarche over the reported arrest of two officials in Islamabad. The sources said that démarche made it clear that there should be no interrogation or harassment of the Indian officials, and the responsibility for the safety and security of the concerned diplomatic personnel lay squarely with the Pakistani authorities. Pakistan was asked to return the two officials along with the official car to the High Commission immediately. The Indian High Commission in Pakistan had said in the morning that two of its officials were missing and the matter had been taken up with Islamabad. The incident took place days after two Pakistani officials at Pakistani High Commission in New Delhi were deported for espionage activities in India. Back home, in the Union Territory of Jammu and Kashmir, 3 terrorists were killed in a fierce gunfight that broke out between terrorists and security forces in Turkwangam village of Shopian district this morning. Official sources said that the joint team of Shopian Police, 44 Rashtriya Rifles and Central Reserve Police Force launched a cordon and search operation in Turkwangam village based on an intelligence input about the presence of terrorists in the village. The spokesman said that when security forces approached towards a suspected spot, the hiding terrorists fired upon them. The fire was effectively retaliated by the joint team, triggering off an encounter which resulted into the elimination of these terrorists.
In a significant decision, the Administrative Council of the Union Territory of Jammu and Kashmir has decided that no new appointments in Jammu and Kashmir will be made under SRO 202. The Administrative Council, which met under the chairmanship of Lieutenant Governor G.C. Murmu, approved the recommendations of a high-powered committee headed by Chief Secretary B.V.R. Subramaniam. In its recommendations, the committee suggested that no new appointments be made under SRO 202. It also recommended that probation period for all appointees under SRO 202 will be reduced to 2 years from 5 years. And now let's take a look at the weather forecast for today. The minimum temperature in the national capital Delhi was 28 degrees Celsius and the maximum is expected to be around 42. The city may have partly cloudy sky today. Mumbai will have a generally cloudy sky with heavy rain. The minimum temperature was at 25, while maximum will be 31. In the south, Chennai will see a generally cloudy sky with light rain. The maximum temperature will be 39, while the minimum was 30. Kolkata will have a generally cloudy sky with 1 or 2 spells of rain or thunder showers. The minimum temperature in the metropolis was 26, while maximum will be around 32. In the Union Territory of Jammu and Kashmir, the minimum temperature was 25 in Jammu, while maximum is expected to be around 41. The city will see a mainly clear sky. In Srinagar, the minimum temperature was 14, while maximum will be around 31. The city will see a mainly clear sky becoming partly cloudy towards afternoon or evening. In Gilgit, the minimum temperature was recorded at 15 and maximum will be around 34. The sky will be mainly clear and become partly cloudy towards afternoon or evening. In Muzaffarabad, the city minimum temperature was 20, while maximum temperature will be around 38 with mainly clear sky. Chandigarh will have a partly cloudy sky. The minimum temperature in the city was recorded at 29, while maximum will be around 39. In Dehradun, the minimum temperature was 24, while maximum is expected to be around 35 with partly cloudy sky. There is a possibility of rain or thunderstorm or dust storm as well. In Hyderabad, the minimum temperature was 25, while maximum will be around 35. Bengaluru will have a minimum temperature of 21, had a minimum temperature of 21, maximum will be around 30. Ahmedabad will have a minimum temperature of 24, maximum 34. Bhopal had a minimum temperature of 25, while maximum will be around 35. Patna had a minimum temperature of 26, while maximum will be around 34. Guwahati had a minimum temperature of 24 degrees Celsius, while maximum will be around 31 degrees Celsius.
And now, an overview of today's newspapers. Hindustan Times leads with news on Amit Shah's all-party meet, reporting that daily tests will be increased to 18,000. The Asian Age writes that the Home Minister has given directions to install CCTV in Delhi wards and for the doctors to get counselling. COVID impact. Wholesale price index enters deflation zone after 4.5 years is the headline in Business Standard. Mail today has highlighted the spiking cases of anxiety and depression in Delhi in an article titled A Parallel Pandemic, COVID's Heavy Mental Toll. 2 Indian High Commission staff abducted, released by Pakistan is the top story in the Hindu. India-Pak in another diplomatic row, sums up the Tribune. Asian Age quotes Indian officials are saying that the onus of talk with India on map row is on Nepal. The Hindu points out that this is a variance with Rajnath Singh's statement that the row will be sorted out with dialogue. Global COVID-19 cases top 8 million as parts of EU reopen borders, headlines the Hindustan Times. And finally, the Times of India reports on its front page that crude prices are now below $40, but fuel prices in India are at 21-month high.
And now, before we end the bulletin, the headlines once again. Prime Minister Narendra Modi to interact with the Chief Ministers of 21 states and union territories this afternoon. Centre asks states to to engage with private sector for increasing healthcare infrastructure and providing critical care at reasonable rates. Home Minister Amit Shah directs installation of CCTVs in all COVID hospitals of Delhi. Tamil Nadu announces complete lockdown in Chennai and adjoining areas from Friday till month end. 2 Indian officials of the High Commission arrested in Pakistan released. India joins global partnership on artificial intelligence to actively participate in development of artificial intelligence. For details of these stories and more, log on to our website www.newsonair.com and News on AIR app. And with that, we end the morning news. Have a nice day.